When you are in a position of leadership, a lot of times you have to deal with patients who are not necessarily satisfied with patient care. And even if you're not in a position of leadership, this is something that will cross your path typically. It is inevitable. When those times arise, you have to be aware of the situation and take into account every part of the story. For example, you have to speak to the patient and the healthcare provider to find out both sides of the story. You then have to decide whether the expectations of the patient was above and beyond what could even be managed by the healthcare provider. You also have to decide whether the healthcare provider was remiss in delivering the appropriate care to the patient. As a leader, you are taking into consideration the whole picture. As a leader, taking care of your staff is your number one priority. Taking care of your staff is as important as taking care of your patients. If you take care of your staff, ultimately, your patients will be taken care of. I remember a story when I had a patient who was complaining and she was causing disruption out in the lobby about her wait time. She had waited a fairly long amount of time, longer than usual. However, we had an emergency that came in during the time that she was waiting. It was a horrible, horrible accident that required extra hands and caring for the patient because the patient had coded. You see, when a patient is coding, typically it is several nurses to one patient, not to mention all the other healthcare providers that are in the room. This patient ended up dying due to his injuries. So unfortunate. He was very young and his family was very distraught. In the midst of all the chaos, someone thought that we had an active shooter in the building. As a result, there were about 5 team members in the corner crying because they thought that their lives would be taken that day due to the false assumption that we had an active shooter. As we all know, this is a real and present danger in this day and time, and it was very scary. I went to comfort them and gave them time to collect themselves. I needed to go out and speak to the patient that was complaining. I went out and I talked to her. And I tried to explain to her the circumstances without violating HIPAA, without giving her too much detail. She was not happy with my response, and I had to tell her that I'm sorry. I'm sorry that you're unhappy. I do apologize, and I wish the circumstances were different. She continued to complain. I told her that I needed to get to the back because I needed to ensure that the flow of the department was maintained. Now, given the circumstances, I knew that the best place for me was to comfort the staff. The most important thing that you need to know is how to handle the situation. To decide what is your priority. Prioritizing is a skill set that is usually developed over time and is vital in healthcare. It is a valuable and important asset in leadership as well. Don't let the emotions of the moment skew what is most important. This patient was not critically ill. Her vitals were stable. And in performing an assessment, there was absolutely no compromises to her airway. Therefore, she would have to be seen and treated according to her acuity. Had she been critically ill, the scenario would have been different. However, it wasn't. I was very polite in my actions, and I told her that I needed to get to the back so that I could manage the department, so that she could be treated and seen in a timely and reasonable time period. Learning how to have emotional intelligence in the moment is a game changer. Being there for your staff is a game changer. There are things that I had to learn the hard way, and that's one of them. Our goal of VP Nursing is to give you these snippets of knowledge so that you are able to lead full, empowered lives and also to decrease error at the bedside. You all are amazing, and thank you for listening. This is a dialogue, not a monologue. Leave your comments below, and don't forget to hit the subscribe button. This is Dr. Viola Pierce, the Nurse Nurturer, nurturing healthcare providers one message at a time. Have a great day.